This might be hard to believe, but in the United States, someone has a heart attack every 40 seconds. Deborah Pinkerton spoke with cardiovascular experts, the sponsor of this segment.
We're here at Cardiovascular Experts in Camp Hill. Joining me right now is Dr. Raj Dave, President and CEO of Cardiovascular Experts. Thanks for being with us.
Welcome.
Tell me, are heart attacks more frequent during the holiday season?
So first of all, I want to tell all your viewers happy holidays. And yes, the research have shown that during the holiday season, there are 3 days where we see the highest number of heart attacks in the United States. It's December 25th, which is the Christmas day, the day after Christmas, 26th, and January 1st. So there are many reasons for this to happen. As we know, there are lots of risk factors for having heart disease, smoking, diabetes, high blood pressure, hypertension. However, also the time of the year and stress is also known to be a risk factor for having heart condition. And that's very important at the holiday time because everyone gets really stressed out. There is lots of things going on in their life. They sometimes miss their medications. So they overindulge themselves in rich, saltier foods, alcohol. So yes, it's absolutely true that there is more heart attacks during the holiday time. And we should be aware of it.
And that's really why it's during the holiday season that's why it happens.
Absolutely, yeah.
Now, you have a few points that you can give us to sort of keep in mind during the holidays so that we can avoid something like a heart attack.
Yeah, so I tell my patients all the time that don't get caught up in too much during the holiday time because everyone has a long list of things that they want to do. They have lots of friends to get together, lots of parties, lots of gifts buying, and they're frantically trying to check off a long list of things that they want to do. And I think that they really need to step back and say, okay, let's, try not to do too much. Not every holiday tradition needs to be honored every year, in my opinion. They can honor some traditions, not all of them. They can pardon themselves from some of the holiday parties which are stressful. I've seen in my 20 years of practice many heart attack patients that showed up straight from a holiday party where they met some people that caused an immense amount of stress and gave them a heart attack. So, feel free to excuse yourself from one of those parties to make time for some rest in between. A lot of people gets caught up into this idea of that, this Christmas I'm going to change the world, and they start doing a lot and they want to become very physically active. So I think I always warn them that yes, you be physically active and that's a great thing, but don't overdo it. Most important thing that is always listen to your body because a lot of people don't want to seek medical help during holiday time. So if they're having chest pain and say, oh, well, it's just the shoulder or whatever, and I'll see a doctor next year. And I think that's a problem. And that's part of the reason why we see sometimes people get very sick during holiday time because they're not listening to their symptoms. So these are some of the important things. Don't overindulge yourself. I mentioned that earlier. I think a lot of saltier foods leads to a lot of admissions during holiday time for heart failure. That can lead to heart attack. It can lead to heart arrhythmias. And you can see that the hospitals get really full during that time.
Okay, lots of really good advice. We're going to talk about heart attack symptoms coming up right after the segment, but we need to take a commercial break. Stay with us. We will be right back. Welcome back. We're here at Cardiovascular Experts in Camp Hill, and we're actually here in an operating room in the facility. Joining me right now is Dr. Raj Dave, President and CEO of Cardiovascular Experts and a patient of his for us deep. We're going to talk to you a little bit later, but first, we did talk, Dr. Dave, about the increase of heart attacks during the holiday season. Why don't we talk about what are the symptoms of a heart attack?
So the most common symptom for men as well as women today for having a heart attack is chest pain and shortness of breath. Most of the time, almost 80% of the time, this chest pain feels like a chest pressure. It can radiate into the neck, it can radiate into the jaw or into the arms. And that should be the first warning sign. Especially in women, there are occasional atypical symptoms such as they could feel nausea, fatigue, tiredness, vomiting. Those are some of the atypical symptoms and presentations of the heart attack, but the most of the time, we want people to look for chest pain and shortness of breath.
Dr. Dave, that's great to know those symptoms. Now for us, why don't you share your story with us?
Sure. Actually, it happened this Saturday right before Christmas, a couple of days before Christmas, and I was responding to a stroke call in Lancaster General. I'm in medical devices, so I was on my way there to respond to a stroke, and I felt this just terrible pain in my chest. It was a penetrating pain from my chest to my back, radiated all down my arm. I just knew that there was something wrong, and as soon as I felt it, I called Dr. Dave, who's a great friend of mine, and I asked him what I should do. I also called my brother, who happens to be a cardiologist as well, and they both told me to go and get checked out, get an EKG. I actually did. I got an EKG and it turned normal, so I was a little bit of relief, but Dr. Dave insisted that I go to the ER and get a troponin level check. Once I did that, the troponin level came back positive, and he knew that I was having a heart attack. He came in right away and put me on a table much like this one, and I was able to put stents in my right coronary artery and save my life.
Wow, what an amazing experience. Dr. Dave, why don't you tell me what type of surgery did you perform on an operating table like this?
Yeah, so today the standard of care in the world when somebody is having a heart pain, or if you want to call it a heart attack, or there are many other medical terms for it, is to use a small plastic catheter that we use to go inside the heart artery, and then we run our equipment and put a stent in and open up the blocked artery and restore the blood flow. And that was the procedure which was done on Firas in a same exact room like this one, and that's where all these procedures gets done.
Yeah, that's truly a life-saving operation. What message do you want to send to our viewers?
Well, something that's very important is just listen to your body. When it happened to me, the first step was always denial, that I'm going to be okay, this can't be happening. I was only 42 at the time, but in my heart, I kind of knew that there was something wrong, so I followed through on that, and I'm really grateful to have done that. I'm able to be around for my family and for my boys, and it's very important to just listen to your body. When you feel that there's something wrong, follow through with it. We have this incredible medical equipment all around. We have incredible physicians like Dr. Dave. They're able to help you. They're able to extend your life so you can enjoy it. So listen to what your heart's trying to tell you, no pun intended.
That's certainly some great advice. Dr. Dave, how can our viewers get in touch with you?
They can go to our website. We have a dedicated page for heart problems, and they can learn more about it, or they can call our office for consultation or even a question, and we're happy to answer them. Our phone number is on the screen.
Thank you both for being with us.
Thank you.
Thank you so much to Deborah. Again, if you would like more information about cardiovascular experts, go to cardiovascularexperts.com/holidayheart or call 717-727-0480. As we go to break, we thank cardiovascular experts for sponsoring the previous segments. We'll be right back.